Mamata Medical College for the presentation of Inguinal Hernia. To honor the dais.
Siva Kumar, sir.
Siva Kumar from
Mamata Medical College.
Please present.
Good afternoon, sir. My patient, Mr. Srinu, a 35-year-old gentleman, agricultural laborer by occupation, presented with the chief complaints of swelling in the right groin since 4 months and pain since 10 days. For presenting illness, patient was apparently alright 4 months back. To start with, he noticed a swelling in the right groin is insidious in onset and gradually progressing to a 10% size. Swelling is reducing on lying down and reappearing on standing or after activity. He developed pain from the last 10 days, which is dull aching and is reducing on lying down, and it is aggravating on doing activities. Coming to the local examination of the both inguinal scrotal region, patient is examined in standing and supine position, exposure from umbilicus to the mid-thigh. On inspection, a pear-shaped swelling of 6 by 3 centimeters is seen in the right inguinal region, extending from above the medial half of the inguinal ligament to the upper pole of the right testis. The skin of the swelling is normal. There is visible expansal cough impulse. There is no visible peristalsis. Coming to the palpation, there is no local rise in temperature and tenderness. All inspectory findings are confirmed. On Siemens 3-finger test, cough impulse is felt over the deep ring. On ring occlusion test, the swelling is not reappearing. On finger invagination test, the cough impulse is felt over the tip of the little finger. Right testis is palpable. The cord structures are normal. Coming to the percussion, there is dull note heard over the swelling. On coming to the parotid examination, there are no visible malgenic bulges in the lower abdomen. On distal rectal examination, there is no abnormality detected. With this, my provisional diagnosis is a 35-year-old gentleman with right-sided, indirect, incomplete, reducible inguinal hernia with omentomous content.
What you missed in the examination, in the total case? What you have missed? You did a...
Murthy garu, ikkada unna vallani koncham alanistaara.
No, sir, for the benefit of those guys.
No, meeru chance is the 1 minute for you at the end. The questions that are not covered by this jury, you can, as MCA inspectors, you can question them. Thank you very much.
So, this is a patient 35 years age.
Yes, sir.
So, what is the importance of age? How do you look at inguinal hernia case by going through the age? What are the things you will keep in mind?
35 years of age group, they usually don't have any muscle weakness, sir. They will be having usually indirect inguinal type of hernias. So that is the main point that has to be noticed.
If there is a young child,
Young child also, indirect inguinal hernia is the most common types.
have you examined the scrotum?
I'm sorry, sir.
Have you examined the scrotum in this patient?
Yes, sir. I have examined the scrotum, sir. Right testis is palpable and the swelling is extending up to the level of upper pole of the testis, sir.
When you said the right testis is palpable, doubt comes for the left testis is impalpable. So both sides.
Both the testis are normal, sir.
Okay.
Opposite groin examination is also normal, sir.
We will only pertain the questions to clinical exam first for a minute.
Yes, sir.
You said when the patient lies down, it is disappearing.
Yes.
Is it disappearing automatically
It
or
is.
manipulation?
It is disappearing spontaneously, sir.
Automatic.
Yes.
Is it the point in favor of?
It is in point of, it is favoring the direct inguinal hernia, sir.
Okay, that's fine. Perfect.
Yes.
Did you ask for any precipitating factors in the history of present illness?
Yes, sir.
Or predisposing factors?
Yes, sir. I've asked for chronic cough, sir, and I've asked for any constipation and asked for any voiding difficulties, especially the urgency and
Voiding means?
frequency, micturition, and urgency.
Okay, in dysuria.
Yes, sir.
Dysuria. Perfect. Did you examine the genitalia?
Yes, sir.
What for your examining?
To know whether it is a scrotal swelling or the inguinal scrotal swelling, or only an inguinal swelling which is extending into the scrotum. The main thing. And second thing is to differentiate this swelling from the swellings arising from the cord structures or from the.
No, I agree with you. He's a male patient, isn't it? Male or female?
He's a male patient.
Did you hold the penis and palpated it?
Sorry, sir.
Did you examine the penis?
Yes, sir.
Felt it for what?
To look for any deviation of the penis and also to.
Are you interested in the deviation of the
stricture
penis or anything more than that?
stricture urethra we have to rule out, sir.
You will examine for phimosis,
We have to send,
stricture urethra, palpable
Palpable.
stones.
Yes.
So you did a PR in this
Yes.
case. For what you have done a PR in this case?
To know whether there is any enlarged prostate and to look out for any rectal tumors and to look for the membranous part of the urethra.
Which do you expect in this case? If the chronic
Urethra strictures I'll be expecting.
No, no. By doing a PR.
Yes, sir. To look for any.
You said prostate. Do you expect a prostatic
No, sir.
enlargement?
This is not the
Your
combination.
more interest is the anorectal.
Anorectal disease.
Okay, perfect. Then, testis you have examined.
Yes.
Did you examine for the testicular sensations? Is it important or not?
It is normal, sir.
In this case,
In this case, it is normal, sir. There is no.
not important.
Not-
But you examine.
Yes.
How do you examine the testicular sensation?
The patient will be
Though
completely.
this is operate question not to be asked today, but yet some interest is there. How do you examine?
The patient will be having discomfort, sir. Whenever it is palpated, the patient will be having.
What type of any final year students, because without wasting time, as my Ravindra says, short case, see how to feel, apply a gentle pressure over the testis, ask the patient on the
Sickening feel.
contralateral side
Yes, sir.
and ask him to remember what type of experience he is having in the ipsilateral loin. Suppose it is a right side lesion, first I gently palpate the left testis. He will have a sickening sensation, which is a subjective feeling of the patient, which you cannot explain and which a woman cannot experience. It's the only male experience, obviously.
Yes, sir.
And the same amount of gentle pressure apply on the ipsilateral disease side. Ask the patient, are you having the same type of feeling in comparison to the contralateral normal side of the sensation? If he says it is present, the testicular sensation is present. Otherwise, it is absent.
Yes.
If you apply more pressure, pain occurs. This is a defense in a rape basis. Remember. Thank you. Any question? So going apart from this, yeah. Any questions from the floor, Murthy?
Felt in the abdomen.
In the loin, I said, sir.
Periumbilical.
Loin is in abdomen, sir.
Periumbilical, sir. Periumbilical. And a sickening sensation, periumbilical feeling of nausea. And
Actually, it is a visceral sensation felt in the abdomen.
Okay, right. That's the
next,
question.
sir, before that, he missed that.
Any other questions?
That's why I wanted to, did you examine the pain? Already you asked, in every case of inguinal hernia, you should see for exclude phimosis, metastasis, stricture urethra.
Yes.
Okay, you should, for the postgraduate, I tell you, I was a registrar for a PG examination. External examiner came from Chennai. The student was presenting this hernia case. He said, sir, there is a swelling in the right groin. Examiner asked him, I don't know what is groin. Then there the student stuck. There was the end of the discussion. What is groin?
Groin, it extends below the level of hypogastric region, just above the medial half of the inguinal ligament, sir. Whereas the loin, it extends in between the 12th rib, posteriorly and inferiorly, and above the level of iliac crest.
The answer I too don't know, but I didn't know. The examiner told, the Chennai man told, groin is a place where the anterior part of the trunk attached to the anterior part of the thigh, which is covered by the strap of the bikini or underwear. That place is called as groin.
Provided they wear bikinis. Okay.
You said finger invagination test you heard.
Yes, sir.
Is it mandatory to do the finger?
No, sir. Nowadays it is not being done, sir. It causes discomfort to the patient. So
For
it is-
completing discussion, what is finger invagination test? Not finger examination, finger
Finger
invagination.
I'll be using my left finger. For this case, I'll be using my right little finger, sir. I'll pass the right little finger from the base of the scrotum and up to the level of pubic tubercle. Then I'll rotate the finger. I'll feel the pubic tubercle. Then I'll advance it up to the level of superficial inguinal vein. Then I'll look for the potential of the superficial inguinal vein by asking the patient to cough. Once the pillars, if the superficial inguinal ring is not able to admit more than one little finger, it indicates it is not
Okay.
normal ring.
Yeah.
If it is admitting my finger easily, then it indicates it is a lax superficial ring.
Very good,
Then-
you are invaginated well. So what are the points
Then,
in favor of it? Indirect inguinal hernia.
Then I'll advance the finger still upwards, sir.
Now we substantiate, summarize the points in favor of it.
Inguinal.
Right indirect inguinal hernia.
First is age group of the patient, sir, 35 years old male with a swelling in the right groin of 4 months duration. And on examination, there is a visible expansion.
Points in favor of indirect inguinal hernia. 4 months doesn't go in favor of direct.
Yes.
It can go.
Yes.
What are the strong points in favor?
Piediform shaped swelling with an expansor cough impulse felt over the deep ring, sir. And also cough impulse felt on the.
I object, sir. His diagnosis was right-sided direct hernia. You present it as a direct hernia.
No, sir, I was saying.
No, he has told right indirect inguinal hernia as a
You said
diagnosis.
that-
Only the points he said 1 point diagnosis is on lying down, automatically swelling disappears. That is his observation.
It's just a defined hernia.
Hernia is a protrusion of a part or wall of the viscus through the wall that contains it.
Hernia's definitions you can't change.
Yes.
It's abnormal protrusion of viscous, a part of viscous through an opening in the wall surface containing cavity. Repeat. It's abnormal protrusion of viscous, a part of viscous through an opening which may be normal or abnormal in the wall surface containing cavity.
The definition is abnormal protrusion of the hollow viscous or solid also,
Solid.
like momentum, into a preformed sac. In a preformed sac has to be formed. Right.
Ask what is normal protrusion.
Sir, sorry.
We'll go. It's a short case, short and sweet questions, so that the student will get confidence. How do you confirm your diagnosis?
So it is a clinical diagnosis, sir. There won't be any.
Still you want to confirm, you have a laboratory, radiologist is coming to your place. patient
Only in cases of
comfortable.
occult hernia where we can't find any swelling on examination, then we can take help of ultrasound, sir.
Ultrasound, it sounds well. You can earn money also. Right? Then how do you manage this case? It's uncomplicated, you say.
Yes, sir. It is
Supposing this patient comes, what counseling you will do? You have confirmed the diagnosis. Patient says, no sir, I want medicines. What is the counseling you give to the patient?
in that case, I'll be saying that I'll be explaining the symptoms of complications involved in conservative management of the inguinal
I am
hernia.
the patient. You tell me what you are going to tell. Mr. Rangareddy, look here. If you don't get operated, number one.
One thing is, first thing is irreducibility is the first main complication that can occur, sir. If it progresses, then irreducibility and incarceration can occur. If it followed by strangulation, and if the content is appendix or Meckel's diverticulum, in those cases, inflammation of these organs can cause inflamed hernias.
But doctor, I heard trust is a good alternative. Why don't you suggest trust to me?
I will suggest a surgery, sir.
Please suggest a trust.
Trust,
No, that is all old timer. Never. They will not be helpful. Number one. Number two, how do you diagnose a case of a strangulated inguinal hernia? This person, how does he present after a week or 2 months or 3 months?
patient will present with an irreducible hernia with constant pain.
Strangulated hernia to diagnose. How do you diagnose a strangulated?
Patient will present with an irreducible hernia with features of obstruction and also a constant pain over the groin region. And on examination, there will be a tense and tender swelling over the inguinal region with bruising or
Local
edema.
examination, you're telling. What about a general examination?
General examination, the patient will be toxic, sir.
Toxic?
Toxic and
Then
he will be dehydrated.
tachycardia, tachypnea, and pyrexia. These are the things. Local examination.
There will be a tense and tender swelling
Tender
with
swelling.
edema or bruising over the swelling.
How management of strangulated hernia is going to be different from elective hernia surgery?
In case of elective hernia surgery, we
Here
will
he is asked, listen, this patient is having a diabetes, came with you, 35-year-old with a strangulated hernia. How do you manage?
in this
Not
patient,
take a surgery in the midnight he has come.
yes, sir. In in this patient, first we need to look his condition, sir. Look his general condition. If his general condition is well permitted to proceed for a surgery, then we can take him directly to surgery. If his condition is not well, then we have to continue with the resuscitation and we have to take him to the operation theatre as early as possible to relieve the strangulation, or else the bowel will get infarcted. And in case of electro hernia repair, we will be dissecting the sac entirely up to the level of the deep vein.
No, emergency only. You did talk about the diabetic status in this case. Yes. Do you look into that status or not?
That is important, sir, because the patient might be having ketonuria and also he might be in ketoacidosis. We need to confirm that.
Thank you. You are telling me to look into the diabetic. That's very important. Thank you very much.
What is the footnote of inguinal hernia in Bavarian law? In the treatment of inguinal hernia, obstetric inguinal hernia, there used to be a footnote in the Bavarian law. What is that footnote?
Patient has to be just as for
Danger lies in delay, not in surgery.
Any questions from the postgraduates, please? The postgraduates, Ravi, I understand. You have a lot of problems. Okay, with this.
Sir, one question. What is Gary's stricture? Garre, Gary's stricture related to inguinal hernia. Garre apostrophe S, Gary's stricture.
obstruction is the level of neck.
No, please read. There is a stricture. You
read. Yes. Last one important question practically. The patient is having right indirect inguinal hernia at the right vaginal hypocele.
Yes.
How do you proceed in this case to operate?
I will go with an inguinal scrotus incision, sir. Then I'll be doing the herniotomy first, and then followed by that I'll be going with the
herniotomy. You do this? Herniotomy.
Sorry, sir. Hernioplasty. Hernioplasty is the better option for this patient.
Patient is not affordable for hernioplasty.
Then we can go for I can go for herniorrhaphy.
What type of herniorrhaphy?
Shoulder repair is the best repair of all the anatomical repairs.
Okay. Elderly patient of right indirect inguinal hernia, 60 years old, the prostatic enlargement comes having prostatic symptoms. How do you proceed in this case?
Depending on the PGH grade, we can go for I can go for surgery, sir. If he's having grade 1 or grade 2, I'll go with the conservative medical management, and along with that, I'll go for elective hernia repair. If he's having a grade 3 or grade 4, then I'll go for the
I don't know this grades. The post-voidal residue is 120.
In that case, I'll go with surgical management of the BBH first. Then, followed by that, I'll be going for the hernia repairs.
Next day or next week?
After same thing.
Next day, next week, next month.
Next month is the.
You will get two such pills. In the same sitting, you can do a TRP followed by hernioplasty.
Yes.
This should be the answer. Any other questions, please? Wonderful. Thank you. Congratulations. Your passed the exam. We'll go forward.
Very good.
So you have passed the examination. Answer boldly. Just give me.
You want to ask only Rangareddy? You wanted to ask Rangareddy?
How do we define incarceration as a complication of hernia?
A very good question.
Incarceration actually is the bowel content will be irreducible. That the content will not be passing to the distal lumen, and as a result of that, the lumen the bowel can't be reduced. So it is considered as one of the earliest reasons for the obstruction. So if it is not relieved, then the patient might develop obstruction.
So should we call it an obstruction or?
No, it is an incarcerated. It is a different term.
Can we call if omentum is the only content of the sac and we cannot reduce it, can we still call it incarcerated?
No. In that case, it will be just an irreducible hernia.
Only irreducible.
If at all the blood supply is intact.
Now that
Thank you.
incarcerated hernia is gone nowadays.
Sir?
Incarcerated.
That is to be written in the book as one of the complications. Okay, that is the second step in the complication. After irreducibility, incarceration, then obstruction and strangulation. Right? Nowadays, this particular terminology, it is not so clear. Okay, that is why nowadays what we say, irreducibility, obstruction and strangulation. Right?
Of course.